Hey, good morning, Dr. Kran here from Dr. PK Life. And today I want to discuss briefly about post-concussion syndrome, PCS, which is a complex disorder. I've seen few cases recently, so I thought maybe talk about it briefly. Usually, as internists, we don't see that many of post-concussion syndrome, but this week, in fact, two cases. So I had to read up on it and also update my knowledge about it. So I thought wanted to discuss briefly so that you are aware. Post-concussion syndrome is a complex disorder where there are symptoms after concussion which can persist for months and years after initial injury. And A concussion is a type of mild traumatic brain injury caused by blow to the head or fall or any kind of trauma to the skull, which jolts the brain inside the skull. So, what are the symptoms of post-concussion syndrome? It varies quite a bit, but what I've seen is that there are physical symptoms and cognitive part, and the emotional part. The physical symptoms usually sees headache, migraine, dizziness, vertigo, fatigue. People are sensitive to light and sound, and sometimes they have blurry vision. Cognitive symptoms is always very concerning. People have difficulty concentrating. They have memory issue. They are slow in processing their thought process or even speech. They have difficulty organizing their thoughts. Emotional component and behavioral component can be very, very disruptive, and usually a lot of irritation, depression, anxiety, mood swings, and sleep issues. And what are the causes? So nobody knows the exact cause. Like lots of things in the medicine, we don't know the exact causes, but it's believed to be a result of combination of physical damage to the brain and psychological factors. And what are the risk factors? Age, older people are more prone to PCS. Women may have higher risk of PCS because of hormonal differences. Previous concussion, they increase the likelihood of developing subsequent PCS. People with a mental health history like anxiety and depression or PTSD are at higher risk. How do you diagnose this? There got to be history of concussion or head trauma, and when the symptoms, physical and cognitive and emotional, those persist for longer than typical recovery period, which could be a few weeks to a few months, and you got to rule out other causes of those symptoms. And there's no single treatment. You have to treat the patient symptomatically, for the headache, and the cognitive treatment for cognitive issue, and for emotional issues you need counseling, therapy, some antidepressants, and lifestyle modification. Make sure you sleep well, and stress management techniques, some vestibular therapy for vertigo and dizziness, and also psychiatric referral and neuropsychiatric referral and neurology referral is also recommended to have expert consultation. So that was a brief about post-concussion syndrome. Have a great day.